Right, Jessica. How do you think all that went?
I think it went okay. So we talked about the problems with high cholesterol and what her goals should be and the things she needed to do to lower her cholesterol. So stop smoking and exercise, and we talked about the best drug.
Yep.
And she was a bit worried about that, but we sort of talked about that. And I think when she left, she was quite happy with what we'd worked out.
I agree. I think she was happy. I think she liked you. What do you think you did particularly well?
I think I reassured her about the worries with the drug.
Sure. You certainly covered the muscle problems well. Did that well, I thought. Yeah. Anything about that interaction that you were a bit uncomfortable with? You thought you might have done perhaps a bit better?
I thought maybe I could have asked her a bit more about what happened last time she tried to stop smoking.
Sure.
And maybe talked a bit more about the problems with exercise. Because we didn't sort of uncover what the real, why she wasn't sort of comfortable with doing exercise. Or
look, I'd have to agree with that. I think just remembering it, she almost wanted to talk about her cigarette smoking, but you kind of dismissed it as soon as she said she put on weight, rather than saying, that is acknowledging the problem and saying, even acknowledging how difficult it is to give up smoking, because we know how difficult it is. And actually talking a bit more about it, because, in a sense, the medicine is only just one aspect, isn't it, of, trying to reduce her risk. So, and you spend a moderate amount of time on that and perhaps not enough time on the smoking and exercise. Again, with the exercise, maybe a bit more about that, about gradually building up fitness and so forth. Having said that, you really, I thought you interacted well with her. But I think we tend to in medicine get often carried away with medication and less about lifestyle stuff, and yet lifestyle changes are so important. So I think maybe a bit more on that. So if I were to ask you, what you might do now, in order to try to address some of those issues, what would be your plan?
With this patient, or just in general?
The next one that comes along with similar sorts of issues.
I think if they sort of brought up an issue that, like weight gain with smoking and quitting smoking and not wanting to do that, then I might sort of ask a few more questions about that, or let them talk about that a bit more.
And what about saying something to them about that?
Like asking them why they wanted to quit before and how that went. And
yeah, that's always good to do that. I was more getting to acknowledging that it is a really difficult thing to do, and that it's very hard for people in general, and they have to put a fair bit of effort into it. So acknowledging that it's a problem rather than it's easy, all you've got to do is do it. So I think that's important, to acknowledge how difficult it is and encourage them to keep trying. That's important. So look, that's fantastic. Let's go over the form now, the mini CX form. In terms of, and not all of these domains are relevant to that particular interaction with Mrs. Lockwood, wasn't it? So I thought the way you interacted with her was very satisfactory. You established good rapport, your eye contact was good, you were listening to her, just that you just needed a few more words to let her know how you were feeling and how difficult it was for her, so that was important. So that really talks also to your professionalism and humanistic qualities, which are, just need to be a bit more expressive with those, that's all. You covered the medicines, the side effects, the need to take them on a regular basis. I thought you did that well, and I thought, in terms of your organisation, how do you think that went?
I think it was okay. I think we started off with some of the things that she needed to look at, like the high cholesterol, and I explained why that was important. And then we went through the medication and lifestyle, and then we talked about side effects, and then we made a plan for next time she was going to come in. And I think she was a bit worried about the medication, but I think we talked about that, and so that was okay.
Okay. I just wonder whether you thought that you started off with medication, then you did a bit of lifestyle issues and then move back to medication again, where you might sort of try and put some of those things together.
Yeah, it felt like I jumped around a bit.
Yeah, I think you did a bit. So how do you think you might do that a little better?
Well, I think that was just me sort of jumping all over the place. I think if I have a maybe, because I talked about the medication first and she asked about that, and then I sort of got sidetracked. So maybe if I just stuck to one topic at a time.
Okay. And how do you, with the patient, how might you kind of set the scene for that, do you think?
I'm not sure.
Okay, well, one thing you might like to think about is very early on is, say there are a number of issues I'd like to talk about. Set an agenda. So I'd like to talk to you a little bit about lifestyle issues like smoking and exercise, and then I'd like to talk to you about medication. So cover them and start with one, move on to the other, make sure she's happy and understands that all of the issues related to the first issue, then the second issue, and then the third. Just gives you a bit more of a platform. It's, she knows what's coming. And so just think about that, setting an agenda and then trying to stick with it a little bit. You need to be a bit of flexibility there. Does that sound okay?
Yeah, so that she knows what's coming next as well.
She knows what's coming next. And you can also plan it so that you finish all of the cigarette smoking issues, all of the exercise issues, and then move on to the medication. So that's good. So overall, yeah, that was a satisfactory performance, but as I said, there are a number of issues that you need to look at. You need to think about those over the next few patients and then gradually change the way you interact with the patients in this sort of setting. Is that okay?
Okay.
That's fine. Okay, we'll leave it at that.
Okay.
Thanks a lot.